tea.
Okay, great. Good.
So should I read?
Yes, of
Yes,
course.
please.
Okay. First question, option A, what medication do you and your family use? My family and I use common medication like paracetamol for the fever, cough, syrup for cold, and sometimes vitamin. The second question, option B, where do you get this medication? Do you need a prescription for them? We got this medication from a pharmacy and or medical store for simple medicine like paracetamol. We don't need a prescription, but for stronger medicine, we need a doctor's prescriptions. The second question, describe the last time you were not well, include of this four sentences. So the last time I was not well, I had a bad cold and fever. What was wrong with me? I had a high temperature, sore throat, and runny nose. Part of the body affected, my throat, head, and nose were affected. And professional medical advice, yes, I visited a doctor, and what I did to get better, I took medicine, drink warm water, rested a lot, and eat healthy food. After a few days, I felt better. And this is my extension work.
Very good.
So good, Samaya. And really
Thank
interesting
you.
to know that information about the medications, very similar to our country. So thank you.
Yeah.
Thank
So
you,
the next,
teachers.
no worries, that was lovely. Thank you. Malika, you were the next one in. Have you got an extension for us? Or do you want to read some words? Okay, the next person in, I'm thinking.
Hello, teacher.
Oh, hello. Hi, Malika. Do you want to read words or do extension activity?
Yeah, this I want words, but this okay.
Okay.
Did you want? Yeah, that's what you want, Malika. Yeah.
Yeah.
Okay.
She wants words.
From last week's class, and dentist up to metrist, hospital, clinic, appointment, pharmacy, prescription, disease, injury, so far, medication, advice, vaccination, injection, blood, aching, tablets, vitamins,
Ointment,
cough, sneeze,
lozenges. Lozenges.
Lozenges.
Good.
Shoulder, stomachache, earache, sore throat, dizzy, influenza.
Good. Thank you, Malika. That was really good and some hard words there. Optometrist, the second word. Can you try and say optometrist? Optometrist.
Optometrist.
You know, you guys are doing so well because I know how hard English is for those, you know, when we speak a different language, it's really hard to get the, you know, where we put the emphases in the stresses in a word in English. It's hard. So you're doing so well.
Yeah. And even where to break the word up, because this one's very strange because you say Tom. You don't go optometrist. You go
and that's what I mean. The stresses are so hard in English. You know, we just take it for granted. But when you speak another language, stresses go in, like in Indonesian, we have just very steady stresses. They're not like this. They're all the same in every word. So it's very hard to do a new language. And English is a hard one. Optometrist is the person that we go and see if we want to get our eyes checked. and get new glasses, maybe new spectacles if our eyes are not going well. So we get our eyes checked by the optometrist. Okay, thank you, Malika. Okay, the next person in is, I'm assuming Samsung is Samira.
Yes, I was
Is
going
it
to say.
Samira? Samira, are you there?
Could Samsung change their name anyway, and we can come back to
Yeah,
Samsung if they would
yeah.
change their name,
So
please? Yeah.
Samsung, you change your name and I will move to Freshta. Freshta, do you have an extension activity?
Yes, dear teacher.
All right, thank you. So
Miss
would you like?
Nikki, can I
Yeah,
interrupt for a second? Could one
yeah.
of the Dari speakers say it in Dari, please, to Samsung? Maybe Samsung doesn't
Yeah,
understand what we are trying to.
Yes,
that's
teacher, I
true.
will say.
Thank you,
Thank
Samaya.
you.
Welcome. Samsung SM ام 26 اد امين نامي چیسته من نام خود را نوشته که استاد میگه
Thank
تشکر
Thank
you.
you. Thanks, Samaya.
I said
Thank you.
Okay, Freshta,
welcome.
do you have an extension activity?
Yes, dear teacher. I want to
Okay.
learn words.
You want to do words? Okay, no worries. Okay, we'll do the next line thing of words. Go.
Sorry, teacher. Block,
Locked. Yep.
block, broken, spread,
Concussion.
Freshta, do you have a little person in your house?
Yes, teacher.
That's so cute. How old is that person?
3 years, teacher.
Oh my goodness, she's like my little granddaughter's 3 years old. That's exactly what she'd be doing. It's good practice for her. She can say the words if she wants. That's okay. That would be practicing and good. It's good.
I don't know English, but she know English. Farial.
What is her name?
Farial.
Fariel. Hello, Fariel. How are you? Are you? You are so clever. What a clever girl. Would you like to read some words with Mum? Yeah? Okay, let's go. Okay, this next one, concussion.
Concussion.
Yep.
Diarrhea.
Diarrhea.
Oh, teacher, that is so.
It's very hard. Diarrhea.
Diarrhea.
Diarrhea. Good. Good.
Stupid.
Yep. Constipated.
Constipated. And
good.
Nonsense.
Very hard. You got all the hard words. Nauseous. Yep. Good.
Vomit.
Vomited.
Vomited. Oh, okay, teacher. Vomited.
That is like when you. Yep. Okay. Yep.
Menstrual.
Good. Menstrual. Good.
Menstrual.
Yep.
Bleeding. Urinary.
Yep.
Infection.
Yep. This one very hard. Very hard. Gastroenteritis.
Enteritis.
Good.
Good.
Allergy. No, teacher, sorry. Allergy.
You're doing well.
Allergy. Yeah.
Allergy. Brace. Bruise. Wound.
Yep.
Examine. Pressure.
Temperature.
Yeah, teacher, sorry.
You're doing really well. It's hard words.
Because last week I not I don't know. I not
Missed
joined
class.
Yeah, so you're learning the words for the first time, and these are very hard words. And you won't know the meaning of some of these if you weren't here last week, but don't worry, we will come to them, okay? So try another, say, 5 words. We see how you go. Go.
Okay, teacher. Pressure.
Yep. Yep.
Sorry, teacher.
This one is hard.
Examination.
Very good.
Examination.
Yep. Good.
Very good.
Pulse.
Good.
Good.
Organize.
Okay. Now this one very hard. So try.
Antihistamine.
Oh my
Antihistamine.
goodness. Very good.
Yeah.
Good.
Thank you, teacher. Suitable.
Good.
Suitable.
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 Yep.
Okay, teacher. Fever. Unwell. Urgent.
Good.
Good.
So you can practice these with Farial for the next week. She seems to know all the rest. She's very good.
So good.
So cute. Okay. So thanks, Freshta. Hawago. Hawago? Are you here?
Yes,
Hawago?
dear sir. I am
Hello,
here.
Hawago.
Hello,
Hawago, do you want to
sir.
do extension or do you want to do words?
Yes, I want to extension.
Beautiful.
Great.
Go.
Thank you. What medications do you and your family use? Where do you get this medication? Do you need a prescription for them? I want to answer this one.
Yes.
We
Good.
usually use common medications like paracetamol and paracetamol for pain or fever, and brufen for a headache or body pain. And question B. Where do you get these medications? Do you need a prescription for them? We get these medicines from a pharmacy or a medical store. And
Good.
some medications need a prescription from a doctor, but others, like paracetamol, can be bought without one. And the second question, describe the last times you were not well. Include what was wrong with you, the parts of the body affected, whether you received professional medical advice, and the things you did to help you get better. And the question two. The last time I was not well, I had a fever and a bad headache. My head and the body were affected, and I also felt very tired.
Mm.
I did not see a doctor, but I took paracetamol and rested at home. I also drank warm water and slept a lot. After a few days, I feel better. Thanks for your attention, dear teacher and nice classmates.
Very good. Thank you so much. I just noticed both you and Samaya too. Like it sounds very much like you do things like as we do them in Australia, but except that you both mentioned medical stores. And I don't think we
Yeah,
have medical stores. So that
they do
was
it. We do in
interesting. Yeah.
Indonesia. In
You
Indonesia, we have
do.
medical. Yeah.
Okay.
But we have
Yeah.
the
Thank you.
Yeah.
pharmacy. Then we have stores that sell all this like herbal meds and like non-prescription meds and balms and all that. Yep. Yep.
Yeah. Yeah.
Yeah.
So thank you. That's yeah.
It's good to know, isn't it? Yeah.
Yeah, it is. Yes.
Welcome.
Yeah. And also you both had similar symptoms, similar illness, which is also very, very common in Australia too. So The same all over the world.
Yep.
Yes.
So the next one we've got up here is Hadia. Hadia. Hadia? Nope. Okay. Next
Yes,
one
I'm
we
here.
have. Oh, hello, Hadia. How are you? All right. Good. Have you got Hadia? You weren't here last week, so you might not have extension. But do you
Yeah,
want to practice reading some words?
yeah, the vocabularies.
All right. Let's read it
Okay.
one page of words. Okay, go.
In the name of Allah, dentist, optometrist,
Yep.
hospital, clinic, appointment, pharmacy, prescription, disease, injury, suffer, medication, advice, vaccination or vaccination,
Vaccination.
injection, okay, injection, blood, ashing,
Ache, ache, and
ache,
achy.
yeah, ache,
Yeah.
achy,
Yeah.
tablets, vitamins, ointment,
Mhm.
cough, sneeze, lozenges,
Good.
shoulder, stomachache, earache, sore throat, dizzy, influenza.
Good work,
Very good.
Hadia.
Yeah,
Very
yeah,
good.
yeah.
Very
And
good.
how do
Okay.
your pronunciation is more like ours, more British. You say vitamins, whereas the other two it's saying vitamins, which is the American. Oh, sometimes
Is
in
it? No,
Australia
we
they
say
also say
the
vitamins.
English say vitamins.
Oh, okay. Maybe I got it wrong around the right.
Americans
Australians say
say vitamins.
vitamins.
Yeah.
No, no, no.
Well,
I say vitamins in Australia.
I know, but in
Yeah.
England we said vitamins.
Okay.
I don't know what they
Okay.
say in America because I've never been there.
Yeah. I've heard, yeah. And cough,
And I am
whereas the
never
other,
going there.
not now, no.
Oh, no, no, no. Okay. So the next one is Zora. Zora, are you here today? Okay.
Yes, I'm here.
Hi, Zora. Zora, you weren't here last week, so you might not be able to do the extension, but would you like to practice reading some words?
Yes, I should read these words.
Yep.
Yes.
Yep.
Okay. Blocked, broken, sprained, concussion,
Good.
diarrhea,
Good.
Good.
constipated. I don't know this one.
Nauseous.
Nauseous, vomited, menstrual, bleeding, um, urinary,
Good. Urinary.
Yeah.
Good.
urinary infection, goes through, I don't know,
Gastroenteritis.
gastroenteritis,
Yeah.
allergy,
Normally we just say gastro, so don't worry. Yep. Go.
allergy, and bruise, wound, examine, temperature, pressure, examination, pulse,
Yep.
organize, antihistamine, suitable, fever, anvil, urgent.
Okay. So with examine, see that one? It's examine, not examine. So can you say that
Okay.
one? Yep.
Examine, no,
Examine. Good.
Yeah.
And with antihistamine, in English, we usually say, in Australia, we usually say antihistamine. I don't know what they say in America. They
No,
might say
yeah.
So
Antihistamine. Yeah.
yeah.
I think it's, yeah.
Okay.
Yep.
All right. So good work, Zora. For someone who wasn't here last week, that was terrific. Okay, we have a few more minutes. So Sarah Pashtunia. Are you here?
Yes, ma'am.
Hi, Sarah. Sarah, do you have an extension or do you want to read a few words?
Ma'am, I want to read a few words.
Okay. Okay, go. Okay.
From
read.
last week class, dentist, optometrist, hospital, clinic, appointment, pharmacy,
prescriptions, disease, injury, suffer, medications, advice, vaccinations, injections, blood aching, tablets, vitamins, ointments, cough, sneeze, lozenges, shoulder, stomach, earache, sore throat, dizzy, and influenza.
Influenza.
Very good.
Good try, Sarah. That
Influenza.
was good. There's a
Yeah.
couple of words you might want to try this one again. What's
Because
this one,
other people
Sarah?
also had struggled with this one.
Yeah.
Yeah.
Do you know this one, Sarah?
Vaccination.
Good. Yeah, that
Vaccination.
was right.
Good.
Yeah,
Good. Perfect. That's really good. Mahen, I've
Thank you,
missed
ma'am.
you. Mahen, we can just fit you in.
Hello.
Hi, Mahen. Do you want to
Hi.
just read some words or did you prepare an extension?
I think I prepared the extension, the first one.
All right, let's go. This one?
Yes, the first question. What
Okay.
medications do you and your family use? My family use run or the running.
Mm-hmm. Is that for
Did you?
medication? Do they what do they take in what sort of medicine do they drink or they eat? What do they take?
I think a vitamin.
Yep, good.
Yes.
Good. Thank you. That's good.
Where do you get this medication? Do you need a prescription for them? My family get this medication from a clinic.
Good.
Mm-hmm.
Do you need a prescription for them? I think no. Describe the last time you were not well include. Teacher, I need to get one of them in this part.
Okay, go. Well,
Just
just
do
one if
one.
you want.
Yes.
Just do one because
Just
we're
tell
running
us
out of time.
what was wrong with you. Yeah.
What was wrong with you when you were not well?
Okay.
Did you have a cold or did you have a fever? Was
A
something
sore
hurting?
head or
Yeah.
a stomach
Headache?
ache?
I think when I was little, I was very sick.
Mm-hmm.
Just
Ah.
like sickness when I jumped from the couch and I
Oh no. Mm-hmm.
Did you break
Yep.
something or did you hurt your head?
I didn't break anything, but I didn't know my eyes closed.
Concussion.
Yeah.
Maybe you had
I
the
have
concussion.
a lot
You
of
might.
fever.
Yeah. I
Yeah.
hope you
I
feel.
had a lot of
I hope.
a lot of fever.
I'm glad you got better quickly. All right. So I think we could
Thank
start the
you.
lesson now. Thanks, Mahen.
Okay.
You're welcome.
Thank you.
So, do you want me to start, Jade, or?
Yeah, please.
Yeah, okay. So
Yeah.
now we did health and sickness last week, and this week we're doing some more things about health and sickness because this topic is very important. If you come to a new country, you really need to know how to speak about this with people because this really affects your life. So it's very important. So more on health and sickness. Before we start, we acknowledge the traditional owners of Australia and pay our respects to their elders, past and present. So we're going to do lots of activities in this lesson, lots of activities. So let's practice what's wrong with you and parts of your body. So you can see some of these are from last week. So I'm going to choose people that might have been here last week. And I think then those people might be able to help with this one. I might start with Samaya again. Samaya,
Yep.
do you think you can do mix and match for this?
Yes, dear ma'am. So, let's practice. Yes, this one also.
Yeah, so you just
Yeah,
read,
so
you
just
have to read the
read this
sentence.
one.
Read the
And
sentence,
then
match it to the picture.
Okay, sure.
Kate.
Kate serves from migrants. So I think it's depend number one.
No,
Mm,
migraine is when you have a I don't know whether did we say this last week,
yeah, we
Jade?
did. Yeah,
We
yeah,
did?
yeah.
I think
Okay,
These are
okay.
from
it's
last week.
three.
It's
Yes,
3.
good
Very
word.
bad
Yeah,
headache. Yeah,
yeah.
that's good.
And
Yes.
Kate,
Okay.
also the other thing to help you is Kate in English is a girl's name. So that also helps you because number
Yes,
one is a
teacher.
boy. Yeah, yeah.
I think I don't know this name. So
No, I thought that. Yeah.
Very English name.
Muhammad
Yeah.
Yeah.
Muhammad has high blood pressure. So I think it's um number seven.
No, there's no
No,
7.
no, number four. Number four.
Oh, number 4. But look at the blood pressure.
Mm-mm.
It's blood pressure.
Oh
What
yes,
is
it's
number
number
4?
six.
It's
Yes,
number
it's number
6.
Number
six.
6.
You can see the blood pressure machine.
Yes.
Yeah.
Mm-hmm.
Okay.
Miss
Then
Idris sprained her fingers. I think it's number two.
Good.
yes, you can see her finger is sore there. Yes.
Yes. Fatima has a rash. It's number five.
Good.
Uh,
Good.
Ricardo often feels tired. It's number one.
Yes,
Good.
he's in bed.
And
Yes.
who has a fever? It's number four. It's
Yeah.
Yeah.
the baby, not the
Yeah, so
baby.
you can see
Yes.
the temperature here, and the fever is when you get the
Yes.
temperature goes up. And then you can see on this girl's hand, Fatima, you can see she's got like a spots on her hand where maybe she got the itchy, like a rash. So
Yes.
good choosing. Okay, good. So we'll go to the next.
And the
Okay.
other part of who has a fever is it's the little child because he's
Yes.
got 40 degrees.
Oh
Yeah.
The
yeah,
38
fever.
who has
degrees
the
is also a
fever?
little bit. Yeah.
Okay.
Good
I
work.
forgot to say. Yeah.
Yeah.
Okay.
That's right.
So let's practice with the next one. Now, these are a little bit tricky. I don't know whether we did menstrual cramps. I don't think
Yeah, we
we did.
did. We did. Yeah, yeah,
Oh,
we
we
did. Because these
did.
are all these. Yeah,
You're
this
so
is all.
clever, Jade, because honestly, my brain
This
has
is
gone into a
revision. Yeah.
meltdown. Yeah,
Yeah. We
terrific.
said we talked about
We did. We
menstruation.
did.
Yeah. And we talked about, yeah. Anyway, I'm pretty sure we talked about cramps. I might
Yeah,
be a little
cramps
bit
is like
wrong. Yeah.
a pain, very
Yeah.
tight pain in your body, right?
Yeah.
Okay. So let's go with Malika. Are you here today?
Yes, teacher, I'm
All
here.
right, we're going to go with Malika. Malika, because you were here last week, I think you can have a try of this one.
Okay.
Okay. All right.
Hego has a runny nose. Number 2,
Mm-hmm.
Good.
Good.
Jenny has menstrual cramps.
Yep.
Mm-hmm.
Number 3,
Well, think about menstrual is when, every month
menstrual
we all get the bleeding, when the women get the bleeding, and then we get a pain sometimes. Which part of the body do you get pain, like sore pain when you
menstrual cramp.
menstrual means monthly, so the monthly
Yeah.
bleeding.
Or periods is the other
Or
word we use in English.
yeah,
Period.
we sometimes can use period, but like what I'm saying is that it's the pain you get when you get the monthly bleeding that women get, only women. So we get a pain somewhere in our bodies. We'll keep going. Let's go with Maisie has a toothache. What's that one? Maisie?
Jenny has no. Which number?
Oh, we'll leave that if you don't know. We go to Maisie has a toothache.
Okay.
Let's go with that.
Maisie has a toothache. Yes, number 4.
Good.
Good.
Yeah. Trudy?
Yeah, that's
Yep.
just the name
Trudy
of the
needs
person.
to be a pee urinate often. She has UTI.
Good.
Which is a urinary tract infection, right? So something in her
Yes.
urinary. Which one?
This number 6.
It's interesting because when you have urinate, when you urinate, it is when you are passing water out of your body, right? So you
Number
can
5.
see, yeah. So you can
Yeah.
see where that lady is holding there, where it's hurting. It's where we pass the water, right?
Okay.
Yep.
Okay, and
Yeah.
then
Jack has a sore throat. Number 1.
yep.
Good.
So which one is Jenny has menstrual cramps?
Yeah.
Oh, Fatima has a stiff neck.
Fatima has a stiff neck. Neck. This number 3.
Good.
Good.
So which one is Jenny has menstrual cramps?
This number 6.
Okay, because
Good.
when you get that's where we get the pain in our stomach sometimes. So when we
Yes.
get the bleeding, we get the pain. I used to, Jade didn't, but like some people do. Okay, go. All right.
Most people do. I was just lucky.
Yeah, most people do actually. So again, we've got more of these. So let's
One
try. So
more.
that was
I think that's
Malika.
all.
Okay. Well, I've got my next person is Freshta. Let's see. Freshta, let's try you.
Okay, teacher.
Okay, go.
Red has chest pain.
Mhm.
Yep.
Number 2, cheese. No.
No, it is
No,
on
you
his
wait.
chest. Yeah, but
Chest. Yeah,
yeah,
it's a good try, but yeah.
yeah.
But what somebody's holding their chest like it's hurting. Who is that? Do you know?
It's number 5, teacher.
Yeah, good
Good.
work, Freshta.
Yeah.
Okay.
When me feels noses.
Yep. So
Mm-hmm.
nauseous. You feel like
Noses.
vomiting. Hi, Ariel.
Nauseous.
Okay.
I don't know, teacher, what's the meaning of nauseous.
Nauseous means when you feel like you're going to vomit. Like when you get a stomach pain and then you want to like be sick and the food will come out of your mouth. It's not nice. It's yuck.
Throw
Like bleh.
up. We also say throw up. Yeah.
Yeah, but then that's very dramatic.
Yes.
So it's
Medics,
probably vomit is like when somebody is like they eat something bad for your body, and then your body wants to get rid of it, and it comes out of your mouth, like, and you make a yuck noise for it, like that.
And another one is like motion sickness, like when you're in a car or a boat, there's people who get sick and they throw up, they vomit.
Yeah. So let's just leave that one. We'll come to the next
Yeah.
one. What about this next one? Ali gets muscle. You read that one. First up.
Yes, teacher. I don't know what's my
Don't worry about when, May. Let's go to this one.
Okay, alligates, muscle, cramps,
Muscle. Yep.
muscle,
Yep.
cramps, and his height.
Thigh. Thigh is the
Thigh.
top part of the leg. The top
Height.
part of the leg. So
Okay,
look at the
number
picture.
3.
Yep.
Yep, that's good.
Yep. Next one.
Barbara has a stomach itch.
Ache.
Number 1.
Good.
And Hong Shin doesn't feel well.
Right.
Number 6.
No, somebody who's looking like, oh, I don't feel very well.
Yes, teacher.
Which one is that one?
Number 4.
Yep.
David's hertz sounds normal. Number 5. No, number 2.
No, number 2.
Good.
So which one
Yes.
is the one that is feeling nauseous?
Number 1.
No, that was Barbara. She has a stomach ache.
Oh, yes.
But it could have been nauseous because you do feel
could.
it in your stomach like
You
this.
do feel it in
But
your stomach.
this picture is supposed to be of a woman throwing up. She's covering her mouth because she's just about to throw up, to vomit. Yeah.
You
Sorry,
Google
I
it,
was using the
check
wrong-
it in Dari.
Yeah.
Okay, that's
Yes.
good. But good try,
So
Fresh Start.
So these exercises were to practice we did the parts of the body last time, and we did lots of words and phrases to do with how you feel, what you tell the doctor, etc. So that was why that was the point of doing these exercises, just to practice that.
Yeah. And can I just say, Infinix Hot 40i, whoever you are that's just come in, can I get you to put your name in, please? Samaya, can
last
you
person
answer?
who came in.
Okay, teacher.
Yeah.
In Phoenix, sorry, teacher. In Phoenix هات
Yeah.
چل آیتی استعمل نام خدا تغییر بته.
Thank you.
I
Thank
say,
you.
teacher.
Thank
Welcome.
you, Samaya. Okay, let's go with the next one. Okay. Hawagul.
No,
Are you here?
we're up to lesson.
Sorry, we're up to word. We're going to say word.
Yes.
Okay, so we're going to just
I'll take over here then.
how about
Yeah.
that? Yeah, that'd be great.
Yes. So we're going to do some new words to learn, and we're going to do this particular slide is about inflammation. So especially as time goes by, we know that a lot of your discomfort in your body when you get ill or you hurt yourself is because of inflammation. And inflammation is when where you have hurt yourself, stuff stuff from your blood rushes there. And when it rushes there, it can bring heat. So this one here, the heat in the whole body is going up, and the heat helps you get rid of the infection sometimes. So an infection can cause inflammation. The other thing that happens is with inflammation, all the liquid comes out of the blood, and it fills the area that is injured or infected, and that's when you get swelling. So I think last time we talked about swollen. I think, is that right, Nikki? So swelling.
Yes, yeah, we did say swollen.
Yeah, swollen is like the past participle for people who like that sort of thing, and this must be the present participle. I don't know, Nikki.
No,
They
I
don't
don't know
need to
that.
know.
I don't
We
know
don't
that.
need to know.
We don't know it, so they don't
But
need
it's
to
the
know.
same, yeah, but it's from the same word to swell. So swollen is actually is part of the same word as to swell. Yep. And the other thing that happens when blood rushes to a place is it often turns red. So you get redness, you get pain associated with inflammation. And the other one is this loss of function, meaning that it'll affect your joints or it'll stop you from moving. So that's referred to as loss of function. So this is something that medical people look for as signs of inflammation. Okay.
Sorry, can I just say one other thing? Inflammation, the word, it means it comes from the word flame, which means hot. So that's why we call it inflammation. Somewhere in your body gets very hot, and then all of these things happen. Okay.
Thank you. Okay, so we've got a mix and match activity to go with these ones.
Okay.
So yeah.
I've got Hawagul next. Are you here, Hawagul?
Yes, sure, I'm here.
All right, let's see if you can match these.
Okay. And then follow. Number one, read rashes form at inflammation spots on the skin. This is
Good.
number one.
For number one. Good.
Very
good
good.
work.
Number two, Ali's knee swelled up when he sprained it.
Yes,
Number
good.
two.
Good work.
Number three, inflamed joints feel hot.
Good. And the
Very
reason
good.
she might feel hot all the way,
num-
but see how the little red dots are on the joints. That's why it said inflamed joints. Yeah.
number
Go ahead. Number 4. Sorry for interrupting. Did you lose your connection?
Hi, Hawagul. You right?
Number 4. She must have lost her connection.
Yeah, she did. Okay. Hadia, are you here? Hadia? Okay. Zora? Oh, sorry, Hadia. Hello. Hadia, do you want to try to do number 4? Which one is it? Hadia? No. connection gone, I think. Zora?
Yes, I'm
Hadia, you're here. Good. Hadia, can I get you to do number 4?
So which one of these here do you think goes with number 4?
Are
Which
you here, Hadia?
sentence?
All right. We might move to Zora for now. Zora, are you here?
Yes, I'm here. Number
Okay,
4
which
is
one?
her right dress is too short to use.
Thank you,
Very
Zora.
good.
Okay,
Yeah.
good. All right. So let's go to the next one. Oh, here are some more words. Do you want to do
So
these
this is
ones,
sometimes,
Jane?
yeah. So sometimes especially when you're trying to help a doctor understand what sort of pain, actually the doctor will often even ask you, is that a dull pain or is that a cramping pain or a stinging pain or whatever? So there's a lot of different words to distinguish between all the different sorts of pain, and that's important to help the medical people understand, or even just your friends sometimes, to understand what type of pain you are experiencing. So a dull pain, I should have let you do this, Vicky, because you're going to be way better at doing this. A dull pain is not necessarily very strong, but it's there all the time, sort of nagging at you. A sharp pain, however, is something that occurs quickly and intensely.
So maybe
Stabbing,
like if you get like a cut on your hand very quick and you get that
yep,
sharp, oh, that hurts, or a needle pokes you, you know, when you get a needle and it pokes into your finger, it will be a sharp. And that's why we
sharp
say a
pain.
needle is sharp. Yeah.
And a stabbing pain is very similar. And some people might use these two in the same way, but the stabbing pain can often be more than once. Like it just keeps going. They repeat. Do you think so, Nikki? Anyway,
Yeah.
a throbbing pain is something that sort of thuds, 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 like it's almost like it goes with your pulse. It seems like it goes with your pulse. So it's
Sometimes you
sort
get a
of,
headache like that where it's just like gunk, dunk, dunk, yeah, like that.
yeah, yes.
Yeah.
Yes, and it gives you this feeling that it's coming with the pulse of your blood. It sort of builds up and then goes down and builds up and goes down. A burning pain is something that describes the pain that you can imagine when something is burning. So that's really the best way to describe it, I think. A stinging pain is like a very sharp. It's funny. It almost seems like a high pitch. How do you translate high pitch into something that you
Well, a
feel?
stinging pain is like, when a bee, like the buzzing bee, comes and bites you, or an ant, and it gives you that sharp, quick sting. That's the pain
Yeah.
that a stinging pain feels
Or
like.
the other one might be like when you've got a cut and somebody puts salt water on it, or salty water on it.
Or
It
put some
stings.
medicine sometimes
Or
can make it sting.
different thing. Yeah, on your cut, it will make it sting. Yep. An aching pain is it's a little bit like a dull pain, but probably more intense, and it can actually make you cripple over sometimes. Yeah.
Yeah,
A
like a stomach
tingling,
ache.
like a stomach ache, yeah, or an ear ache. It's kind of a bit of a general word. It's a more general word to describe pain. So if none of the other words work, you can usually use aching, I think. Is that correct, Nikki? Anyway.
Yeah, I think so. Yeah.
Yeah. A tingling pain, the very famous one that is a tingling pain is what we call pins and needles. That's the idiom that we use in English. But when you've bent your leg up underneath you and forgotten about it, and then when you open your leg up, you get all that tingling pain sort of rushing through your leg. That's an example of a tingling pain. So it's sort of like twinkle, twinkle, twinkle all the way up your leg in a painful way.
Yeah.
Now, a cramping pain is very much a pain that makes you want to bend over, or it feels like it's pulling your muscles in a direction, your muscles cramping up. It's usually it's very often associated with your muscles working and cramping.
Get tight. Your muscles get tight.
Get tight. Thank you, Nikki.
Yeah.
I couldn't think of the term. And then sore or tender. Tender is often used with to the touch, so you might have an injury that's healing. And this happens to a lot of people. They're tempted to touch it to see whether it still hurts. And so then we would say it's still tender to the touch, or it's still sore. It still feels sore.
Yeah.
Yeah.
Freshta has put up translations.
Oh, translations. Thank you.
Because it is very tricky. These words are tricky, but it's just in case you ever have to go to a English-speaking doctor and they ask you these things, and you need to be able to say, no, it's a dull pain, or it's not too bad, or it's not too sharp, or whatever it might be. So, yeah.
And it's very important for diagnosing what's wrong with you in a lot of cases.
Yes.
So, also, this is just so that was some more words to do with pain and inflammation. And now we're just doing a couple more words to do with parts of the body, but also a little bit like prepositions of place where it is. So we might say, I have a pain below my left shoulder. So this pain is below, just under the left shoulder. I cut the outside of my lower right arm. So we commented last week that we don't have a separate word like calf for the arm. So we say the lower right arm. This is the person's right arm, and it's on the outside. So if it was on the side that was close to the person's chest, we would say it was be on the inside of the right arm. Then I have a lower back pain. The top of my back also aches. My upper back also aches. So this is the lower back, and this is at the top of the back. I have a sore on my bottom lip. So on not the top lip, we say top lip and bottom lip. So the sore here is on the bottom lip. I have a brace on my right knee. So this is just showing the difference between right and left. That's not a very important one. I scraped my lower left leg. So actually, this would actually be the shin because it's the front of the lower left leg. Okay. So we have some close activities now. We've got 3 close activities, Nikki.
Okay.
Do you want to? Yeah.
So, where are we up to? Is this the one we're up to? Yeah.
Yep. Okay. Yep. Sorry. I was just checking.
All right. Okay. So, Hadia, you only got a chance to do one in the last one. So if you want to have a chance now, you can do this close activity. You have to choose
Hadia,
the right...
yeah. Yes, I was going to say Hadia might not have done closed activities before, so
no. So what you have to do, Hadia, in case you don't know, is we would say the sentence. So we would go, I'll do the first one for you, just to give you an example. The first one would be Ali pulled a muscle in his, and then now I have to choose, is it his left leg or his right leg? And I'm going to say his left, right? His left.
And I'll go, Nikki, and they'll say, yes, you're right.
Yeah. And then we've got which part of his leg, or which part of his body. So it says Ali pulled a muscle in his left. And then I've got to look and see, is it his arm? No, it's not. It's on his leg. But it's not on the bottom part of his leg, which is his calf. It is on the top part. So I'm going to say Ali pulled a muscle in his left thigh, which is the top part of the leg. So that's the first one. I've done it for you. So Hadia, do you want to try and do the next 2?
Actually, that was good, Key. Good explain it to everyone. Thank you.
Yeah. Hadia, are you here?
First, yeah. At first, the pain was sore.
Well, he pulled a muscle. So
Yeah.
what? Yes, sore was good. The sore's fine, actually. That's
Sore's an
fine.
okay backup one.
I'd
Yeah.
give it to you. I would have marked that right. But if you think about it, Hadia, if you pull a muscle and really pull it hard, that it causes, what sort of pain would it be? Would it be?
So what we're looking, and what we're looking at here is the sentence said at first. So you really need to think back when it very, very first happened.
Yeah, it was tingling.
It could be.
Mm,
I would think it was more sharp
sharp.
because the pain sharp is like a very, very strong pain. Like, so when he
Yeah.
first did it, it
Sudden.
would be like,
Yeah, like a
sore.
like a
Like that.
sudden. It's a bit sudden, isn't it? It's a sudden thing
Yeah,
that
like a
happens.
sudden
Yeah.
pain. And maybe we didn't explain that well enough to you.
Oh,
And then,
but that's the advantage of doing these exercises is that then we could get you to think about what happens to you when these things happen, and that helps explain the meaning of the pain. So that's good.
Yeah, that's good. So when you pull the muscle, and it's very sharp at the beginning, but now after a little while, when it all sort of settles down, what do you think it would be? Do you think it would be aching? You say it.
Yeah, I think it would be aching.
Yeah. So can you say
Now
the
it is
sentence?
aching.
You say it, Hadia.
Now it is aching.
Yeah.
Good.
Good.
Yeah.
Good.
Thank
So
you. Now,
that's good.
do you want her to do the next one, or you want
No,
somebody
that's
else?
okay. We'll go to the
Okay.
next person, Hadia. Zora, are you here?
Yes, I'm here.
Okay, so do you want to try and do this one?
And
Okay,
this
the
word is acne. This word's pronounced acne. And it's those
Okay.
pimples that we get on our skin when we're teenagers, especially. Yeah.
Okay, the acne on my left lower jaw bothers me.
Very
done.
good. That was a hard one. Very good.
Well done.
Okay. It is cramping.
Well, cramping is a strong pain, like in your like in a muscle.
Uh-huh.
So this is a
Okay.
different. This is more.
It is tender
Yep.
as well as itchy.
Itchy. Yeah.
Good.
So especially if you touch it, it feels tender. It's
Little
like
bit
you don't
sore.
want to touch. Yeah, you don't really want to touch it because if you touch it, it feels sore.
Yeah.
That's kind of like what it is. Yeah.
Okay. I wash it regularly and apply the ointment,
Mhm.
but that makes it sting.
Good
Very
work,
good.
Zora.
Yes.
Well done.
Yeah.
Okay, good.
Yeah.
That was a hard one. Thank you. Okay.
Sorry, I'm just
All right.
getting. I've lost my. There it is.
Okay. So the next person, I've just noticed Sharon Gould, you came in late. So would you like to try this?
I think she might have been Samsung.
Yeah. No, she
So
was
just
the other one.
So
No,
just
she was the other one in
Oh,
this.
okay.
Yeah,
So just
but
So
that's
just
fine.
read this one, and then there's two closed activities here, but you can read the whole passage.
Okay. Okay. So what we might do is I'll move to Elaha. Elaha, are you here?
Yes, teacher, I'm here.
All right. Let's see if you can do this one for me.
Okay,
And I
teacher.
also have Latifa as well. Yep. Go.
Brent had spicy food for dinner. After the meal, he feels a dull pain.
Yes.
You reckon?
I don't know. That's what I would say.
Burning. This is a little bit subjective, and I'm hoping to talk about subjective in the next lesson. I haven't talked to Nikki about that, but maybe we will. So it is a bit subjective. So I'm going to say, Nikki would say that it is a bit, did you say dull pain?
I would take dull. I'd take any of them, really.
Yeah, okay. But I would go for burning because it's like that acid comes up out of your tummy, and it feels like it's burning your food tube, your esophagus. Yeah. So anyway.
Yep. What's the next one, though? Good try, though, Elaha. What's the next one?
Yeah.
Okay, sure. It was in his chest.
Good. Good. And what's the next? Read the next sentence.
Okay, teacher, sorry, I just lost the screen. Just a minute. Okay, I'm back. It was in his chest. He took an
Yep.
antioxidant tablet to treat it.
Yeah, and
Good.
acid. Acid. So acid
Antacid.
is that
That's
sour stuff.
unusual. Yeah.
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 Okay,
Thank
good
you.
work. Okay.
Do you want to do some more doctor's phrases with?
Oh, okay. Well, here
Yeah.
are some more things. So if you go to the doctor's going to say things to you, and sometimes you might not quite understand what the doctor is asking or saying. So here are some things. So if you have a sore ear or an earache, they might say, "Let me look inside or down your ear." And you can see the doctor's got that special machine, that special device to look in your ear. The other one is the doctor might say, excuse me, while I check up your nose. So they might want to look inside your nose. Or the doctor might say, let me look in or inside or at the back of your mouth. And here sometimes they press a little flat stick on your tongue and then they look inside your mouth. Sometimes the doctor might be looking in your eyes with that light and they'll say something like, or the optometrist sometimes might do it. So it might say, this light in your eyes will be bright for a moment. So they push the light on and it's very bright in your eye. They need to warn
Hate
you.
it.
They need to warn you that you're going to see that bright. And then sometimes when the doctor wants to know if you can feel things in case you're getting your foot or something is stopping feeling pain or feeling any sensation,
Tickling. Yeah.
they'll say, can you feel this? So the doctor might touch you on your foot with some little instrument just to see if you can feel it. Another one, doctor might say, especially if you go in with flu or a cold or something, some infection, they say, let me check if your lymph nodes are swollen. And you can see the doctor is touching around the person's neck, just maybe under his ears as well, to see the
Just
lymph
under
node.
his jaw. Yeah. And see, we use that word swollen again or
Yeah.
swelled up. Yeah.
It means that they become bigger. Swollen
Yeah.
means bigger. So check that in diary for yourselves. Okay. And some other useful words for that the doctor or hospitals might use. Medical history. So they need to look at your medical history. So they will look at what things might have been wrong with you in the past, like if you've had some disease or some injury or something like that. A referral, which is when a doctor has to give you a piece of paper that allows you to go to another type of doctor, which is usually in our culture called a specialist. And a specialist is a doctor that might be just specializing in a certain part of the body, and we'll come to that in a minute. Consent is when they ask you if you can say that it's okay for the doctor to give you some surgery, or sometimes you have to do it for someone else. Like I had to do it for my husband. So he was under anesthetic, so he was not conscious, and they needed to know if they could do another surgery on him. They would ask me, and I can say, yes, you can do that. So that's called consent. Then operation or surgery, you can see here the doctor is cutting the body to hopefully do something good for that patient, remove something bad from their body or correct something in the body. Specialist is a type of doctor who is very special for one part of the body. So it could be the heart, so we call that a cardiologist. It could be the stomach, the digestive system. We call that a gastrologist. So they're different types of specialists.
Yeah.
For women, we have gynecologist or an obstetrician. That's for having babies. A
And
gynecologist.
we've already talked about an optometrist as well.
Yes. Yes.
They're a
So sometimes
specialist.
the
Yeah.
doctor, your normal doctor, who's just your GP, who you see in the office, he can say, look, this is too hard for me to know what's wrong with your heart. I'm going to give you a piece of paper. You take it to the cardiologist or the gastrologist or whoever it might be that you're having the problem with, whatever part of your body, and then you go to the other doctor and give them that referral. Consultation is when the doctor and the patient speak together and the patient tells the doctor what they are feeling, like all those questions that we were saying before, like, oh, I have a throbbing pain in my arm, or I have a burning pain in my stomach, and the doctor can listen and see what's going on. All right?
But it's kind of that time when you just speak together and talk about stuff, really.
Yeah.
Yeah. So the doctor's not doing something to you necessarily. And
No.
just because this comes up with the dialogue, as well as in your medical history, the doctor might also ask your family medical history because there's some things that are genetic. So they want to know whether your parents had some issues or your siblings or your aunts and
Some
uncles,
diseases
etc.
are like they pass through the family,
Yeah.
like some sicknesses. Yeah. So here are some more words that we might come back to but screening is when is a screening like when
Well,
they
this
do
is
a scan, isn't it?
well, it's
Scan.
all screening is really when they send you off for a test, and it
Oh,
can be all sorts of tests. They might send you into for an
I
MRI
don't
or a
even know,
CAT
guys.
scan. Yeah, like a CAT scan or an MRI. I don't know which one is which
Mm.
here. This one is where they put all the little leads over your body and measure your heart. So they're screening your heart in this particular, the heart electrical activity in your, so there are all sorts of different instruments and different tests that they would do. But what they're doing is they're screening. They're trying to find out what things it could be or what things it isn't. Yeah. It's a difficult word to explain, isn't it? So
Yeah.
a part of this screening might include doing lab tests, and typically they'll will take you to get blood taken, and then they'll test for different things inside your blood, or they'll test for different things inside your urine. That would be examples of lab tests. There are other lab tests as well. Diagnosis is an important word. So the diagnosis is when the the medical professionals will actually come to a decision about what they think is causing your symptoms and your problems. So the diagnosis will often be to say that it's a particular disease, or they'll be able to say which part of your body has been affected or broken or whatever. So the diagnosis is the conclusion that the doctor comes to about what is wrong with you. And the verb, the doing word that goes with that is diagnose. I think we might be using that word later. Procedure is a little bit, it's like a very, very small operation or surgery. So here, somebody's getting a little mole or something cut out of their skin, for example. These are examples, I think, of skin. When you have something wrong on your skin, so they just take a scrape off it, or they take a little puncture out of it. There's other sorts of procedures you might have, like if you've got renal disease, you might have. I'm just blanking, Nikki. When you go on
I don't know, but yeah,
dialysis. I'm
sorry
thinking of,
guys,
yeah. So yeah,
renal disease is a hard word.
yeah,
It
yeah,
is when something is wrong with your urinary tract. So it's when you go to the
yeah.
toilet to pass water and there's something wrong, that something could be renal disease with your kidneys, the part of your body that does that. Yeah. Yeah.
Treatment then refers to after you have a diagnosis, or sometimes only if they know what the symptoms are and they're trying to alleviate the symptoms. The treatment is what you are given, and often that'll be in the form of a tablet or in the form of a shot or a
Injection.
injection. Yeah.
Yeah.
And
So
then
the
a lot
treatment is
of,
how the doctor makes you better.
yes. And then often the treatments will come with side effects. And so the doctors are all very careful to let you know of possible side effects so that helps you not to panic too much when the things happen, but also just to forewarn you what they are going to be. Yeah. All right. Another mix and match. Too many mixes and matches today.
So I've got Latifa here today. No, I think they're good. I think they're good for this. So Latifa,
Okay.
you here? Latifa Talash?
Hello.
Hi, Latifa.
I
Okay,
don't
Latifa.
know what
You
time
haven't
is in your country.
you
The
weren't
month.
here last time. Do you want to have a break today and I'll ask someone else? Okay?
Oh no, do you want to do
Yeah.
do this one, Latifa? Did you want to have a go?
Yeah, sure. I try it. Okay.
Okay, try.
Read this
She
out.
just
Yeah.
fixed mix and match activity. Sue endures her knee climbing the stairs. I think it's related to number 2.
Good.
Good. Good work.
Yes. She has an appointment with her GP. I think it's related to number 3.
Good.
Sue is on the examination table. I think it's number 1.
Good.
You're doing really well. Good girl.
Yeah.
Good. Good work.
Sue's knee is screened to detect damage. I think it's number 4. The health words is very hard. Now I saw it in this lesson, and the words are very difficult.
They're very hard,
Yes.
Latifa, but
Yeah.
you know
Yes.
what? You did really, really
Yeah, yeah,
well
yeah.
with this
Yeah.
activity. So you just have to practice pronunciation of those words, but you've done really well.
Actually,
So the
no, they were
name,
good. In fact, the one thing where you could improve your pronunciation is actually in this girl's name. So it's
although you don't
Sue.
need to, it's just a stupid English name.
It's a stupid name, but yeah. But if we say Sue, like you can't tell
Yeah.
from the spelling that that's what it should be.
Yeah, that's true.
But it's
That's true.
but it is a very common
Very
girl's name.
common.
Yeah,
Very
very
common.
common. So
Very
yeah.
common girl's name in English-speaking countries.
Yes.
So
yes.
that's just the name.
It's Susan. Sometimes it's Susan as
So we
well.
could have made that name Latifa, like, or any other
Yeah.
name there, but it's just Sue. That's good. And injure just means to hurt it.
Oh, that's right. Injure. Yeah.
Injures.
She injures her.
Yeah. But you know, Latifa, you're doing very well. So good work. Okay.
So welcome. Thank you.
So here we have another one, even more complicated, I think. So
It's harder to read, yeah. But this is more about the same story about Sue and her knee. So it's a continuation.
She's just continuing this story about Sue. So Gulsum, are you here?
Yes, ma'am, I'm here.
Okay, you've been here for a little while, so I'm going to get you to see if you can do this one for us.
Okay,
it's hard reading.
Yeah, go.
So, has a consultation
Yeah.
Good.
with a specialist who diagnoses her damaged knee. It's number 3.
Very good.
Good
Yes,
work.
that's the
Okay, go.
specialist.
Next one.
Before her procedure, Sue has a lab test to check she is healthy enough for the procedure. It's number 4.
Great. Very good.
Excellent. Okay.
Sue signs the consent form for the surgery. It's number 2.
Great.
Sue has a surgical procedure on her knee. It's number 1.
Gulsum. Good work, Gulsum.
Yeah, that was quite hard.
Absolutely
yes.
fabulous.
Actually, yeah, and we probably should, when we said that when we're talking about the consent form, what it really means is I agree. I agree to whatever you've written up here about what you're
And
going
I
to
agree means that you will be happy for them to do it.
Yes.
That you are okay with them to do it. Yeah, good. Okay.
Yeah, thank you, dear
Very
teacher.
good.
Well done.
Good, good.
Well done. Okay, we've got a
Dialogue.
little dialogue. So Jade and I will read it, and then I will choose two people to read.
I'm
So
just going to check how long it is. I'm just quickly checking. So it's 3 slides.
it's 3 slides.
But
So
there's
we
not
might
very
do it
much
in 3.
reading.
No.
Not a lot of reading. Do it all in one go? Yeah?
Yeah. Okay.
Okay.
So, good morning, Fatima. It is nice to meet you. How are you today?
I haven't been feeling well, but mostly I want to ask you about my sore feet. They are cracked and inflamed.
Let me have a look. Yes, they look inflamed and the skin is dried out. It may be infected. I will write a prescription for some ointment to rub into your feet. I'd like to ask you some questions about your general health. Have you noticed any changes lately?
Yes, I seem to be thirsty and hungry all the time. I often have to get up in the night to urinate, and now and then my vision gets blurry.
I noticed that you have a dressing on your hand.
I scraped my hand on the door a couple of weeks ago.
That seems a long time for the wound to heal. Let me take a look at it. So this story will be continued in the next lesson. We will find out what is wrong with poor Fatima. So I think we'll do this in 3 slides of reading, if that's okay, Jade, because we've got a couple of people need to read. So we'll go with these. Okay.
Yep.
All right. So let's start with Tamkin. Are you here?
Yes, ma'am, I'm here.
All right, Tamkin, you can be Dr. Salvi, okay? And,
hello, ma'am.
okay. Sharon Gul, are you here?
Yeah, I'm alright.
All right, you can be Fatima. Okay, go.
Good morning, Fatima. It is nice to meet you. How are you today?
I haven't been feeling well, but mostly I want to ask you about my sore feet. They are cracked and inflamed.
Let me have a look. Yes. Let me have a look. Yes, they look inflamed and the skin is dried out. It may be infected. I will write a prescription of some ointment to rub into your feet.
That's so good, that reading. We might actually...
Are we doing one? Are we doing...
Yeah, we'll go to the next one, and I'll just see if... I've got Nargis and Rukia here. Nargis, are you here today?
Thank you, dear teacher.
That's all right. You were great. That was very hard reading and very well done. Nargis, are you here?
Yes, ma'am.
Rukia? Okay, thanks, Nargis. Nargis, can you be Dr. Salvi?
I have do like.
Are you all right? Are you all right to do some... Okay, and Rukia, can you be Fatima? Rukia, are you here?
Ma'am?
Yeah? Okay, if Rukia is not here...
I have do like.
Yes, teacher, I am here.
Wait a minute. Okay, Rukia, are you here? Okay, Rukia,
Yes.
you be Fatima. Nargis, you be Dr. Salvi. Okay, start now, Nargis.
About your general health.
You'd like some help?
Have you noticed your change?
Any changes?
Any changes? Any changes? Yeah, lately.
Okay, good work, Nargis. Okay, go, Rukia.
Thank you, ma'am.
Okay, teacher, I would like to ask you some
No,
questions.
Rukia, can you be Fatima?
What, teacher?
You need to read for Fatima. So yes,
Okay,
yeah,
okay. Yes,
yeah.
yes. I seem to be thirsty and hungry all the time. I often have to get up in the night to uh,
Urinate.
urinate,
Yep.
Mm-hmm.
and now and then my
Vision. Vision. Can you do vision?
I think we might have lost her.
That's all right, Rukia. All right. And I'll just finish it up. And now and then my vision gets blurry. Vision is your eyesight. And urinate is you remember that urinate is when we pass water out of our body. Okay? And vision is the word for eyesight, how
How
you
about
see.
blurry? How
And
about blurry?
blurry is like when your eyesight it's not clear and bright. It becomes like you can't see very well. All right? So something is wrong with poor Fatima. All right. So now I will finish up with Mahen. Are you here?
Yes, Miss, I'm here.
Good. You can be Fatima, and Sarah, you can be Dr. Selvi.
Okay, ma'am.
Okay, go.
I noticed that you have dressing on your hand. I scraped on my hand on the door a couple weeks ago. That seemed a long time for the wound to heal. Let me take a look at it.
Good work. Lovely reading, both of you.
Yes.
Wound is so obviously this poor lady, she's hurt her hand by scratching it on the door. The door must have been something sharp on the door. And the wound is the cut on her hand. And the heal means to get better, to get better. So the doctor is worried that her hand is taking a long time to get better. The cut is taking a long time. Okay? All right. So
Okay,
that's
ma'am. Thank you.
good. So this is we will continue the story next lesson. Okay, let's go to the next slide.
So with the next ones are for the practice for before
Yep.
next week's class. So here are some
Lots of
words for
hard
you
words.
to look up and to practice the pronunciation. And then for our extension activity, we have another question about your community. So in your community, what happens if you need a medical procedure or surgery? So just think about what we discussed today, the types of things that you need to do, like even maybe the consent form before you can have some surgery. So you don't have to answer these questions, but if you've got experience with this sort of stuff, you might want to answer this question. And then because we love to hear what your experiences are, so you can describe an injury that you've had and include how it happened, the type of pain you experienced. So you might need to research those words that go with pain to explain it, which part of the body was affected, and whether you required medical intervention. Intervention, to intervene, means that you
The
come
doctor
into
had to
the,
do something.
yeah, to stop things from going ahead. So they come into a situation, they intervene, they stop it from going along the way that it was going.
Yeah. So it's like whether
Okay.
you needed to have the doctor or some specialist to be involved in that.
And you might need to discuss, and you might need to research what an injury means, because it's different from a disease or an illness. It's usually something to do with, for example, when you cut yourself, or when you broke a bone,
Or you
or when
burn
you
yourself.
sprained, or you burn yourself. These are things that are caused by an outside force that happened to you, something that happened to you. Yeah.
Okay.
So we go back and do
We've
more
got
dialogue?
we got 4 minutes left. So I was thinking of going back to the words, the doctor words, and then maybe getting a couple of people to read Those.
These
No,
ones? You think?
the words where we had the doctor, like what the doctor says in the surgery, blah blah blah.
Okay.
Those,
Yeah,
you know,
because
those
they're in
ones. Yeah,
sentences. They're better because they're in
yeah. So then I was
sentences. Yeah.
thinking like some of these phrases, like these ones.
Yep.
So
Yep.
maybe, Elaha, you're here today. You haven't had much of a go, so I was wondering if you want to read. Elaha? Okay. If not, I'll go to Sheringul. Are you here, Sheringul? I'm just the ones that haven't had much of a go.
Yeah.
Sheringul, here today? Okay. I will go to Tamkin. Tamkin? Okay, Tamkin.
Yes, ma'am.
Can I get you to read some of these phrases?
Yes, ma'am.
Okay, read.
Let me look inside down your ear. Excuse me while I check up your nose. Let me look inside at the back of your mouth.
Yep.
This light in your eye will be bright for a moment. Can you
Good.
feel this? Let me check if your lymph nodes are
Yep.
nodes are swollen.
Good,
Good
Tamkin.
work.
Good reading.
Yes.
Okay, we'll go to the next one and maybe Latifa can have a go.
Yeah. And sorry, Tamkin, we should have told you just to pick one of these ones. You didn't have to read all of them, so we should have said that.
There, yeah. The doctor might say different. Yeah,
I think we must have some back here.
Yeah.
There.
Yeah. Latifa, would you like to read these ones, please? Latifa?
My left shoulder.
Sorry, I talked, but I was mouth. Okay.
Never mind.
I have a pain below my left shoulder. I cut the outside of my lower right arm. I have lower back pain. The top of my back also X. My upper back also X. I have a sore on my bottom lip, and I have a brace on my right knee. I scraped my lower left leg.
Very good. Okay, we can get one more person in and it will be Gulsum.
How about, do you want to just practice saying scraped? Scraped.
My lower left leg.
Good.
Good. Okay, we'll get one more slide up just for Gulsum because she just is one that came in earlier that hasn't had that second
I think
go.
we might need to, I think we might just need to do that one again. Yeah.
Yeah, Gulsum, can I get you to read this one too? Gulsum.
Yes, ma'am.
Okay, read.
I have more on what head. I have a pain below my left shoulder. I have a sore on my bottom lip. I cut the outside of my lower right arm. I have a brace on my right knee. I have a lower back pain and the top of my back also aches. My upper back also aches. I escaped my lower left leg.
Good. So Gulsum, here you could say either you could say the top of my back aches or you can say the upper back. So up is up, right? So that's the upper back. So you can choose one of those, but you did really well. And your reading of all of you for these very, very hard words is really good. So I think everyone's done very, very well today with these words. I think, don't you think, Jade?
Yes. Yeah, no, it's great. Thank you.
All right.
Thank
So
you.